This video we are going to discuss about Schick test, skin test, intradermal test, which actually test the susceptibility of person to diphtheria, a disease that is caused because of Corynebacterium diphtheria. Okay, so here in this test we are going to test the person's susceptibility to diphtheria, that is immune status, as well as we are also going to know about hypersensitivity if the patient has to the toxin of diphtheria. So how do we proceed? We actually are going to use both the arms for intradermal injection. The first arm is what is going to be the control arm. So in a control arm, as it is going to act as a control, we are going to use an inactivated toxin. Okay, but in the other arm we are going to as it is a test arm actually, so for testing it we have to inject a real toxin, that is 0.1 ml of diluted diphtheria toxin is going to be used. So now we have two arms with two different injections loaded. Okay, so now we start. So what we see is when we inject inactivated toxin into control arm, we see no change, means no reaction occurs. Even after 48 hours or 4 to 7 days, no reaction appears. Same when we inject a diluted toxin into this arm, there appears no change. Now when there appears no change, there is nothing that is occurring, so the test is negative. A negative test suggests mainly the patient is immune. Patient is immune suggests that the patient has an antitoxin level of more than 0.01 units per ml, sorry, 0.03 units per ml. So this is our guy 1. This guy 1 is happy because he has an antitoxin of more than 0.03 units per ml, and the patients come out to be negative after Schick test. Now we have our second guy. There's second guy. When we do the control arm test, the control arm test shows no reaction, means there appears nothing. But when on the test arm we inject the diluted diphtheria toxin, there appears a wheal reaction in that arm. Okay, a wheal develops that is of more than 10 mm around, and it develops in 24 to 48 hours, but this reaction is going to peak by 4th to 7th day. Okay, this is important. The person starts developing wheal, but it peaks by 4 to 7 days. Now this patient is going to be unhappy because this patient guy second is actually positive case. Positive here suggests that the patient is susceptible to diphtheria, and this patient guy 2 needs to be vaccinated. This is actually how the reaction is going to appear as wheal reaction. We see here of around more than 10 mm. So these were our two guys. Now the third guy comes up, the third guy here. Okay, now what we do again, we inject in the control arm now inactivated toxin, but this is a different scenario. Now the control arm also shows the reaction of wheal. Now the wheal reaction here in control arm is little different. The wheal arm develops a control reaction, that is wheal of more than 10 mm, that is going to disappear by day 2 only. Now any reaction in the control arm suggests that the patient actually is hypersensitive to the diphtheria toxin. So this reaction of wheal in the control arm suggests the patient is hypersensitive to diphtheria toxin. Now the next thing we do, we inject a toxin, that is diphtheria diluted toxin, in the test arm in the same patient. Now again the patient develops the wheal reaction, but this time the patient actually develops 10 mm of wheal that again disappears by day 2. Now this suggests the body started developing a reaction, but actually because of the immunity the patient has, the wheal reaction subsided by day 2. Now patient actually is immune because he has eventually the wheal has subsided by day 2, but patient is hypersensitive. So this patient actually need to be vaccinated, but he should be happy. Sorry, the patient is hypersensitive, but he will be happy because he does not need to be vaccinated because he is already immune. And this scenario is what is known as pseudo positive. The patients come out to be positive because of a hypersensitivity reaction, but actually the patient is okay. Now we have a third scenario here. What we see is on a control arm, again the patient develops a reaction that is of 10 mm, and this 10 mm of flare that develops on the hand disappears by day 2. Okay, this is going to disappear. But what we see in the control arm is this. But what we see in the test arm actually is the patient now develops a wheal that is more than 10 mm, and this doesn't disappear by day 2, and it is going to maximize by 4th to 7th day. Now this patient actually is hypersensitive, but is this patient immune? No, this patient actually is developing the reaction, so this patient is susceptible to diphtheria. Now this reaction where patient is susceptible to diphtheria as well as he is hypersensitive to diphtheria is what is known as combined reaction. Combined reaction here is the patient is susceptible as well as hypersensitive. Okay, and in this case we are going to vaccinate the person. This test is Schick test actually, but it is of not much use nowadays because earlier we had vaccines which had some side effects, so we needed to know whether the patient actually had the disease or is he hypersensitive or not. So this was done. We have 4 scenarios. A negative test means patient is immune, a positive test where patient is susceptible and needs to be vaccinated, pseudo positive case where patient actually is immune but is hypersensitive, does not need to be vaccinated, combined reaction where patient needs to be vaccinated but he is actually hypersensitive. Now note this scenario that when a pseudo positive case comes up, we need to wait up because on day 2 what we see is this reaction we will consider, we will feel like this is a condition of pseudo positive, but actually the condition does not disappear on day 2 and it goes on, and on 4 to 7 day wheal is going to appear. So many a times pseudo positive case can be confused with a combined reaction. Note that scenario. These were bits about Schick test. Hope you liked it. Thanks for watching.